morning. Okay, I do hear feedback. You're not muted on the thing. Is that it? Okay. Okay. Let's see. Good morning, everybody. We're trying to make sure we clear up all technical challenges as we move forward. Okay, I do hear you loud and clear. Hey, Brian. Wait a minute. Hold on, let me bring you up. Well, I was gonna give you like a big introduction and bring you in, so I don't. hopefully, hopefully we'll be all right. Okay, well, let's start. Welcome to our Saturday morning tea, where we discuss health information, news, education, and certification tips. I'm Clarice Warner. I'm the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co-host, today's episode is sponsored by Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. So if you are in Clubhouse, feel free to click the link on the 5 steps to become a certified marketable medical coder if you're interested and not necessarily in the coding space just yet, but you have an interest and a desire to join us in this great profession. Also, if you are on YouTube and or Facebook, welcome. Please check the video in the description box for the link. All right. So today, joining me, as always, every week, my trusty, dependable, reliable co-host, Mr. Jesse, the registered trademark, the coding nurse. Sir, introduce yourself and tell folks all about you.
Good morning, everybody. My name is Jesse, and I live in Philadelphia, Pennsylvania. I have been healthy at 29 years, and 2020, I created my coding nurse LLC, where I help other nurses and other people clinical back into the world of HR.
Okay, cool. Love it. So let's get into today. I am going to ask you about your week though, but we'll come back to that. So today, our guest is the medical coding geek himself, Brian Quee. Brian Quee, RHIA and CDIP. I know the coding nurse will have a lot to talk to you about that CDIP piece. Is an HIM professional with more than 18 years of experience in a variety of roles in health information technology, clinical documentation improvement, adult education, and auditing. I feel kinship already. Yes. Brian holds a Bachelor's of Science in Health Information Management from Florida International University and is credentialed as a Registered Health Information Administrator, or RHIA, and Clinical Documentation Improvement Practitioner from AHIMA. Brian is the Facebook group administrator of Medical Coding Geeks, RHIT and RHIA exam support, and the Clinical Documentation Improvement Network. In 2017, he became the creator and host of Not Elsewhere Classified. I love that title. A podcast created to share stories and insights from professionals in the medical coding, HIM, and CDI community. He is an advocate for HI. Are you drinking tea, sir? Wait, he's an advocate. I love it. He's an advocate. Oh, wait a minute. Hold on. See, Brian is doing some things in the background. Hold on. I'm going to get him too. He's an advocate for HIM professionals in the clinical documentation improvement industry. He serves as a mentor for the American Health Information Management Association. His goal for Medical Coding Geek is simple: promoting the people who make up a medical coder. So, everybody, both live and in Clubhouse, let's welcome Brian, the Medical Coding Geek. All right, all right. Okay, add to the stream. Yay! There you go. You're muted. What? I love it.
I thought we were doing the chicken dance or something.
Sorry.
Oh, that's better.
Okay. Cool. Welcome. Okay, well, now what was that you were lifting up?
I don't know. I saw the coding nurse lift up his tea, so I lifted up my. No, you're drinking something, and then so then I lifted up my coffee.
Yeah, he told me he was not a tea.
I'm not
drinker.
a tea guy, but I brought green tea just in case. I prepared. I also my favorite tea though is in the Chinese restaurants. It's a certain flavor, but it's called oolong. So I brought some.
I'm aware.
I brought some of those.
Yes.
So I'm ready just in case, just to keep with the theme of the show. But thank you guys for having me today.
So over here we spill the tea on all things HIM or health information. And that's where the whole tea thing comes. But I also drink tea every morning. So we have the different teas. And when we first started, I used to tell everybody what type of tea I was drinking, but but you're safe here as a coffee drinker.
Okay, I have. I was also showing my French press, so I'm prepared caffeine wise.
You're doing it all. You're doing all the things. Love it. So when we get started, or before we get started, I'm always curious.
Are we starting now?
We're starting now.
Okay.
I'm always curious about men in this space. Because hi Vicky, welcome. And hello everybody in Clubhouse. I see Terry and Beja and Asha and Yolanda. So welcome. If you would like to join the conversation, feel free to come on up to the stage. But I'm always curious because I've met probably more recently more men in the profession than before. And as my co-host likes to talk about, the gatekeepers, men just weren't involved. And so to see the influx of men in health information is always exciting to me. So Brian, tell me, how did you get into health information management?
Oh boy, you want that story? I mean, I only have an hour. How long do I have?
Really? We're here for an hour. Sometimes we go over, depending on how juicy the conversation goes. But
let's see, what time is it? All right, so because I could only finish for up an hour because my son has his first job today. So I'll tell you a story. That's a different story, but it's me today. So how can I summarize my career story? So how did I get into HIM? I mean, just like any HIM professional, you don't go in thinking you're going to be an HIM professional. I started out thinking I could do physical therapy. Then I looked at the courses and I'm like, oh no. And then I think I was at a point in college, like, what am I going to do? So I looked at biomedical engineering. I looked at pre-med. I looked at nursing, didn't make it into nursing because of, I don't know, they're very strict with the prerequisites, especially for microbiome. I missed it. I just missed it. Just that one little point didn't get me into nursing school. And I tried to prod but I couldn't get it. So I was actually looking into what is it called? Medical technology, where you do the pathology in the lab. But at the time, FIU was closing that program. It was so perfect for me. So if that program didn't happen, I would have been a laboratory pathologist, that type of situation. So I went into career services and I'm like, what am I going to do? I don't want to be in college for so long and without a major. So, this was back in, 2000 and I'm flipping through some of the catalogs, the manual catalogs, and lo and behold, there was this pamphlet that popped out, and it had at the time a formula. The formula said healthcare plus technology equals success. I'm like, wait a second, that's pretty cool. And at the time, my I want to say coworkers, my classmates that we hung out, their majors at the time, I don't know if you remember management information systems. You ever heard of that?
Yes.
And so MIS. And so I figured, well, if they're going to MIS, I'm going to HIM, kind of like the male version. I don't know. I don't know. And I did the program with the focus on, really healthcare technology. Medical coding was never a pathway for me to even think about, because when I got into the program, I'm like, oh, this is coding for, and I graduated and became an HIM technician, started from the ground floor and moved my way up. Decided to be a director of medical records for a jail system. I don't know
Oh,
what,
wow.
yeah, I said, I got my RHIA, I got very overzealous. And I'm like, I'm gonna be a director. Let me just do it. And I was 24 at the time.
Oh, wow. I bet you that was
Yeah,
a whole
yeah. I'm
experience.
like, that
I
was
can
just
only
like, it
imagine.
was like this, like slap of reality, as I would describe it. And I did it for a year. It was a very interesting experience. It was a five facility jail system, 40 employees, 24/7 operations. Your first director job. I mean, that was really an eye opener, a very great experience.
Mhm.
And then the employer that I worked with the HIM technician role, they actually approached me and says, "Hey, Brian," this was 2005, 2006. They said, "Hey, we have a position. It's called a CDI specialist." And there's a story to that, but I've heard of it. I actually got I don't know, just a taste of what it is because the consultants came in before I had left to become a director.
Mhm.
And the only thing I remember CDIs and the coders are doing were just like this. Like, I disagree. Oh, can we agree to disagree? Because of their findings and things like that, because they were trying
Right.
to introduce CDI to their HIM program. And I'm like, oh, I'm gonna be doing this all day, and she said, no, it's not like that. We're gonna. But I have no. I'm not a nurse. And that's what I figured, because they were looking for nurses. They were looking for experienced coders. I mean, again, coding was never in my radar, coming out of HIM program.
Mhm.
And they said, don't worry, we'll train you. I said, okay, we'll give you bonus. All right, that sounds good. And we'll raise your pay.
Just even
Okay.
better.
All right. You know? And I already knew the healthcare system. I already knew the people in HIM. I've networked within that program. And it's like as if I was coming back. And so, long story short, 12 years later, CDI, through the ups and downs, through the MSDRGs, the APRs, the ICD-10, the Epic integration into removing was it CPOE, and removing paper, no longer putting paper queries into paper charts, and no longer going into floors with computers on wheels. I mean,
Yes.
I've been through all of that transition in CDI. It wasn't until 2018 my wife says, let's move. So I live in South Florida. I used to live in South Florida,
Okay.
born and raised in Miami, moved to Broward County, which is Fort Lauderdale,
Oh, love Fort
Davie.
Lauderdale.
Yeah, Fort Lauderdale, around that area. And my wife says, let's move to Central Florida, because we were like, okay, we started looking. She found this house, which we live in currently. And she moves. The story I tell is that she went upstairs, she opened the bedroom, she went like this, and she went I never seen so much giddiness in her face. And so I'm like, man, we gotta move. So we gotta move.
That was it.
And yeah, that was it. And so that transition, after 12 years of CDI, I moved into auditing. And that's where I am today. And actually, just recently, I went from auditor to supervisory role, team lead. And I've been explaining that recently in social media, kind of because I never get the story or any feedback on how people transition from, regular staff role, like line staff role, to an actual supervisory role. Nobody
Mhm.
ever explains to me that that transition. And so I think I'm on a project now just to discuss that, because I know there are coders who, from newbies to graduates to current coders. Now, what's the next step? And I think this is the next step. And I think I'm hoping to clear the fog out of that, in the coming, I don't know, projects or content that I'm going to create. Hopefully
we were
soon.
actually kind of on a similar path as we are talking different pathways in health information.
Mhm.
So, coding can be that foundation or that stepping stone to propel you into other areas. And so I've had a couple of folks interested in well, what are some different pathways, or what are some different
Mhm.
areas that I can go in, and what if I don't even like coding? What can I do? And
Yeah.
so
Yeah.
so we're putting together kind of on the same wavelength some different options and ideas,
We
and
got a good vibe.
providing folks, well, this is the skill level that you need to have, and this is important in order to progress to that next step. So yeah, I think everybody's all on the same page. I love it.
Cool.
So Brian, I'm a quote person. I'm
Mm.
always talking quotes and doing quotes. And I was just wondering, do you have a favorite quote or scripture or saying that you use all the time?
Oh, yes. Oh, so the phrase I say is, what's the worst that can happen?
Hmm.
What's the worst that can happen? Because in my career, um, everything always falls for some reason. Something always falls into my lap, and it's never the career. Again, it never is the career path that I want. So CDI was something that I never wanted, but then I always asked. I mean, but it's not that I didn't want. I think it's just the fear of the unknown. I
Okay.
think that's what it is, right?
Okay.
And so when they present this thing, this opportunity to me, I'm like, what's the worst that can happen, And so I think having that mentality of like, okay, you either get it or you don't. There's always a way out, and that's how I approach the interview. The same thing with my new supervisory role. They presented to me. The story is that I entered, like, I think they do like goals
Hmm.
that you have to enter for the employees.
Hmm.
And so I'm a very curious mind. And so I like to know within my role what happens beyond my role, what happens before my role, what happens to after, and even around my role.
Okay.
And so I'm interested in data. And so I left it at that, thinking like nothing's gonna happen. And
Oh, they were
so
like ding 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 ding
yeah,
ding.
and so
Yes.
my supervisor at the time, she's like, "Oh, you like data? Oh, you're an HIM person. Oh, health data you want, right?" And I'm like, "Okay." And so she said, "Why don't you try out for team lead?" I'm like, "Okay." So then, and again, the situation just falls on my lap, and I asked myself again, what's the worst that can happen?
Right.
And so again, I think just having that mentality and even learning, on the way of doing podcasting for 4 years, that transition into the interview, just like this, if you were interviewing me for a job, you would get this
Right.
and this type of energy. And
Right.
that got me the position. I told them, look, hey, and I ended the second interview like, look, again, the mentality is what's the worst that can happen. I even said that, what's the worst that can happen? Either you hire me and I do a great job, or you don't. And I'm good either way because I like the job. So either way, I got a job, and that's always been, I guess, my mantra for
Okay.
my career. What's the worst that can happen?
I love that. I
Mm.
love that. So today we're kind of me and the coding notes, we're kind of tag teaming. So I'm going to focus strictly on your work around CEUs. I had
Mhm.
a couple of weeks ago one of our faithful listeners, and I believe it was Demetrius, who asked about
Oh,
CEUs and where.
Demetrius.
Oh, you know Demetrius? Okay, it was where can
Yes,
you?
I have a lot to say about Demetrius. All right, so
So it's like what CEUs and what's going on in the CEU space. And so I started researching and I ran into you. And that's how this whole thing started. So I'm gonna kind of focus on that, and then I'm gonna turn the tables over to Mr. Jesse, the coding nurse, and
Jesse.
because
Okay.
you all can speak CDI. And so I'll let you all dive into that.
Sure.
Let me just tell you, I am here in Cincinnati, Ohio, and I've transitioned from medical coding primarily in the physician outpatient space. I too have an RHIA and a whole bunch of coding certifications behind me, but I'm also certified in healthcare compliance. So I transitioned over into the compliance world. So when you said auditing, I'm right there with you all day, every day. And so we have a kinship there as well. Yeah. And so hopefully maybe we can do some additional collaboration as you go through your project on talking about going from, frontline to supervisor, because you're right. There are some skills and there's some information that is golden for people to know and understand in that space.
Sure.
And then we also talk entrepreneurship over here. So, everybody wants to do their own thing, and we are actually doing our own thing. So we talk entrepreneurship as well. But anyway, so let's talk CEU. So I know you have a wonderful, wonderful resource that is online on your medicalcodinggeek.com website. That is the CEU hit list. And I think you update it every month. Okay. So how did you curate this wonderful knowledge for folks on a monthly basis? No doubt.
Can you guess how that happened? And after me talking about my career,
the data.
No. It fell in my lap. It fell in my lap. So how can I go back? Okay, so I started the podcast, Not Also Classified, and one of my earlier guests, her name is Mary Dudash White. I think also from Ohio.
Okay, I think I know that name.
Yes, she is an educator, I believe, University of, I don't know. I know it's Cincinnati, somewhere in Cincinnati. Yeah.
University of Cincinnati. Yes.
Mary Dudash White, very wonderful lady. She oversaw what used to be called hit knots.
Right.
Okay. All right. So I did an interview with her. And so, she, I got introduced to hit knots because of that. And I explained to her, I tried to ask her, why do you do all this? It's the same thing. She was giving out free CEUs. She was giving out free exams. She was giving out free. I'm like, why are you giving out stuff for free? I mean, this is remarkable. And she said, I do it because I love to do it. And so, we parted ways. She continued with hit knots. And then a few years later, which was, last April, I think that's when I first started the CEU hit list. She came to me. She says, I'm retiring. Like, okay. And I'm like, what do you mean, Mary? She says, says, Brian, I would like for you to take over hit knots. But, hit knots is her trademark name because it's hit knots LLC. And so I want you to take over the function of what hit knots is. And so at the time, I was doing my podcast, I was doing my YouTube, I was doing my work, and I again fell into my lap. It was a hard decision to make, because it fell on my lap, and then I asked the question, what's the worst that can happen? And I really had to ponder it because people were saying, Brian, you're doing so much. You're doing so much. I don't know if you could do this. I'm like, oh, what do you mean I can't? Don't say that to me. If I can't do it, I'm going to do it. Okay. So, and I think that energy, saying that I can't do it in where I have a busy schedule, I can adapt. I'm one to adapt. I want to let go of things that I don't necessarily need to do. I just I trim it in a way, I trim the fat, I cut the fluff to where it works for me. And so I said, you know what, I'm just gonna take it on. So I went to Mary. I said, give me your trade secrets. Which I can. It's not that hard, but it's to figure it out. But she's like, give me your trade secrets, give me your resources. Where do you go? What do you do? And she gave me a little bit of. It was really just 2 emails. That's all it was. And she said, I'm retiring. Peace. And so that was it. And I figured with me and just talking with the supervisory role, I need to know what the core function is, right? So I figured out, okay, I need to get CEUs. How do I report that? And so, I think being a well-rounded healthcare professional, I had to also do web design, web creation, blog creation, but I've already done all that. So how do I transition? Sorry, how do I transition this thing from hit nuts to what is now CEU hit list? And so what she also gave me, which is very gold in any professional's toolkit, is a network. She gave me a group, a Facebook, literally a Facebook group. She just went, "Your administrator, peace," and then she's out of the group. that group had, I'm going to give a shout out because I think they were watching, and I shared this link to them.
Okay.
So shout out to the group. It started out with 7,000 people.
Wow.
So
That's what's up.
she built a network of 7,000 people in the group. I'm like, wow. And
Wow.
so I mean, this is me coming from having already a network of Facebook groups, Medical Coding Geeks, which I think is about 11 to 12,000 people over, I don't know how many years, since 2015. I mean,
Okay.
really? I mean, since the it's been that while. It's been that
That's
long.
what's up.
The RHIA network, CDI network, always RHIA support, exam support group, the CDI network, and then now this group. And so now it's a matter of like, I'm the new sheriff in the town. How do I get these things started? It used to be called hit nuts, free low cost CEUs. And so I can't use hit nuts. And so I make the group work for you.
Right.
And so I said, I started polling. I'm just gonna follow what I did with what the other groups that I administer. Let them figure it out because I'm just the guy who pushes the buttons and makes it happen. Like, okay,
Right.
I'm the one supporting. And so I figured we gotta come up with a name of this because I can't use hit nuts. And they were throwing things around, and this, I forgot what's his name, but it was a gentleman. He says, "What about the hit list? What about the?" I'm like, "Oh yeah, that sounds deep and profound and kind of scandalous too." And and so I said, I figured, hit list, yes, like the movies, and kind of like being a bounty hunter of CEUs and being the Robin Hood and giving it back to the community, that type of scenario. Like, I
All
like to
right.
put some type of movie scripting type of feeling vibe
Okay.
into the group. So then I put it to the audience, to the group, and we came up with the CEU hit list. And so I'm the guy, kind of like the group boss, gangster boss, I guess, who goes out there trying to shake the internet of CEUs and then just report it. I mean, if you had to simplify the process, it's once a month. Update the list,
Right.
it's like sending out emails, send it out, and then let it do its work.
Right.
And
Well, I
that's it.
love it. It
That's
is
it.
great. It is
Mhm.
one comprehensive detail. I mean, down to the dates where, you can take your calendar and say, okay, I know I need to get so many CEUs.
Mhm.
Here are some dates of some free webinars, some free information. And then you even have it, well, if you can't make those free or live webinars, here are some on-demand
Mhm.
webinars. And so you
That,
have,
yeah, that came from feedback from the audience. So you always learn from I love feedback,
Mhm.
right? So when I first sent out the first list, it was April, and it says, I get a bunch of questions. I said, I cannot be doing these questions. What if I can't attend the event? How do I get my CEUs? The webinar's not working. I'm like, I'm not responsible for this. So in the beginning of when you go into the CEU hit list, I put an extensive, please read.
Oh yeah, I see that whole thing right
Please read,
there.
because at the end of the day, I am just the messenger. I'm just the one who finds it. I'm the one who just sends it. I do not need to be troubleshooting, please, because I already have enough on my plate.
Amen.
And so you learn as a professional to program, you know, the situation. I don't want
Mhm.
to say people, just the situation,
Right.
and
I can bring
filter it in
you
a
to the
way.
water. I can't make you drink. You gotta
Yeah,
drink.
yeah. So I think you have to put down really firm rules, and
Mhm.
that's within that page. And so far, it's been pretty good. Like, I just
Good.
boop, next, boop, done. And so it's been good.
I love it. I
Mhm.
appreciate this. So for anybody who needs free, and I think most of yours are all free, right? Or I'll do
I
the
used to do low cost, but then the audience, they just gravitate, everybody, anybody, it's not even just our industry. They
right.
gravitate around free. So
Okay.
I
So these
figured
are all the free
let
ones.
me just make
Okay,
it
well,
simple for myself
freebie.
and just free.
You get a freebie, you get a freebie, and you get a
Hmm.
freebie. So
That's
these are
right.
all free CEUs that we all can capture um, to maintain our certification. So if this is recertification season for you and you're struggling to figure out, well, what can I do to get? I can't. My employer won't send me to a conference, or
Hmm.
I don't have the time to go to a
Hmm.
conference. Here is an opportunity for you to rack up some of those CEUs that you need. And again, they're live webinars where he actually lists out the dates. So coming up this week, I think on May
Yeah, tell
18th.
me what's on there because I haven't checked it
Sir.
lately.
May 18th, we have registry impacts of the 2022 standards. And this is about Trauma Awareness Month. And
Hmm.
then there's a privacy and security update for
Hmm.
the OCR and the ONC rules, which is always good information for us all, even if you're not in that privacy security space. Trust and believe it will trickle down to you.
Yeah, yeah.
um, for those who love E&M like me, there is an E&M refresher
Hmm.
on May 25th. And
That's
yeah,
been trending too. Yeah, the E&M updates. Yeah.
love it. Love it. So here is it's at the medical www.medicalcodinggeek.com/CEU hit list. So yes, feel
Yeah.
free to check
One suggestion that I definitely say is catch it early
catch it
because
early.
because I think there was, I don't know if it passed, but there was a 2-day virtual event.
Yes.
2 days worth. I don't know if it has passed yet, but 2 days, like full packed days of events and CEUs. You could basically cover your entire, recertification cycle in those two
It
events.
was last week. It
Or
was
was it?
5/11 and 5/12.
It was a
From
lot.
NGS,
Yeah.
their spring 2022 virtual conference.
And
Look at that.
that was suggested to me. So what's nice about this list is that people are now sending me in
That's what's
these
up.
free CEUs.
That's
Also,
what's up.
AAPC is now sending me their free CEUs to promote. So because it's
Oh,
free, I
good.
mean, I said, look, if you have a free event, it has CEUs, because if you don't have CEUs, my people are, the group is gonna get you.
They're coming after you.
I can't hold them back, and it has to be free. I'm more than willing to put it on the list as long as you give me send me an email, and I will put it month by month, just to make sure it's on there. It's a cross-platform, cross-promotional platform. It's a free content platform for everybody. So
Cool.
I always say pay it forward, and this to me is something that I've turned into, for everybody to use, a resource for everybody
I
to
love
use.
it. I'm
Yeah.
all about being a resource.
Mhm.
And Angela Wilson said it's been a blessing. So there is your testimonial for the day. I'm sure you get them all the time.
I appreciate it. Thank you,
That's
Angela.
what's up. That's what's up. Okay, well, I'm gonna turn the channels over because I know he's chomping at the bit and ready to get in to have this CDI conversation. So I will turn it over to my co-host, Mr. Jesse, the coding nurse.
Where's your coffee, Jesse? Lift it up. You're done with it already? Yes.
I have followed you for years, and it is a pleasure to finally get to meet you.
Oh,
I'm
thank
glad
you.
I can bring that to. I'm glad I can bring that, make that
I
happen.
wanted to talk. Can you hear me?
Yes.
A little bit. I don't know if your volume is kind of sound far, but it's okay. I could hear you.
You said talk a little louder?
Yeah, it sounds
That
echoey
better?
a little bit. I can hear you.
Because now I can't hear it.
Oh, because you're on mute.
Yeah, he's on Clubhouse, and so he normally talks through Clubhouse versus talking through
Oh, okay,
StreamYard
got it. Okay.
for whatever reason.
Oh,
But
so okay, technical.
yeah,
Okay, got
yeah.
it. Go ahead.
So my question is, when in coding period, in HRM period, there has been, like Clarissa mentioned earlier, there's lack of diversity of men. And I think that is partly the reason for the the gatekeeping that happens, especially around CDI. I don't know why, but CDI is this like inner sanctum that is very, very hard to get into. It's very, very hard to even navigate. It's hard to get employment. It's hard to get information. And I have complained ever since I got my CDIP that was the worst exam I've ever taken.
Did you? Oh, really?
In terms of preparation, like the information that they tell you to study to prepare for the exam is not it. The only reason I passed was because I had healthcare experience and I had coding experience and just experience in the whole HIM realm before I even took the exam. But if I had to depend on the resources that they gave me, I would not have passed. And I just wonder, in your opinion, why do you think it's like that?
The exam itself, or just the industry in general?
Wait, I can't hear him, Clarice.
My bad. He said the exam itself or the industry in general.
Okay, so I could start with the exam since we both started have the CDIP. I took the CDIP 2015, right? And this was after 9 years as a CDI. And does it prepare you to become a CDI specialist? No. I mean, if you want me to be very transparent,
spill that tea, sir. Spill that tea.
well, does it? I guess a better question: does it prepare you as an experienced CDI? Do you really like? Does it get you to that next level? Maybe because it's just an added credential to your name. Does it do anything in terms of what you do as a CDI? After 9 years, though, no. I'm like, okay, because I worried about that exam. I'm like, oh my, and then right before the exam, I'm like, I've been doing this for 9 years. I'm like, okay, I think I could do this exam, and I passed. So I could get into in a conversation about what's the difference between the CDIP versus the CCDS. I feel like the CDIP is more like the RHIA version, and the CCDS is more like the RHIT version, because the CCDS is more like in the trenches, doing the queries, doing the work. When you look at the RHIA, the CDIP, it's more like overview, program management. So like if you were pursuing the CDIP thinking, this is a perfect fit for me as somebody who has a goal of being a CDI specialist, no, I just don't think it's designed that way, at least from when I took the test. Because when I took the test, it was it was in the early phase. It just got released. And so I could tell you the story of me waiting for CCDS to come with an exam, and then CDIP coming afterwards, and I'm waiting for the study guide and things like that. And I could tell you that after I took the exam, they came out with the study guide because I had no study guide to work with, and it was very tough. But I mean, if you want to be a program manager, if you want to be a director, I mean, yeah, go for the CDIP. Does it help you necessarily? Yeah, I mean, it does by adding you see there on the screen, RHIA CDIP. It just adds a little, into it. Does it do anything profound for you as a professional? It just gives you a credential. I'm just being truthful, okay? Any credentials that any credential is the same way. You could have a slew of A, B, C, D, E, F, G alphabet soup in your credential, but I think what's most important is how you leverage it, right? You could leverage it that way. So I try not to depend on the credential. I want the credential to depend on me, because that's how I figured it out. All right, so that's the credential. Now let's talk about the industry, right? You're saying that it's hard to get into. It's been hard to get into, period, right? Because when you think about who they look for, okay, are they looking for somebody who is new? Maybe, because it depends, and I've always said this for anything, medical coding, HIM, it depends on what the company wants. And also the second thing is it also depends on what the company's ability to do as far as education. Are they in a rush to meet the bottom line, like the money, or are they comfortable with their budget and they can, put money aside for education to bring in new people? and just like my instance, they were comfortable. I mean, they were financially comfortable, and they brought me in. They were willing to train. The program was new, so like everything was aligned, and it was like, okay, all right, I was in the right place at the right time, you know. But now it's gotten, I've noticed it's gotten really, really competitive, because when you think about the CDIP, the CCDS, the AAPC now released the CDEO, and now recently the CDEI. Okay, you could see what's going to happen. Like when they start releasing all these credentials, it's going to get populated. And when it gets overpopulated, it's going to get competitive. And so when you're in a competitive state, you have to always ask yourself this question: how do I stand myself amongst the rest? What can I bring to the table that somebody else doesn't have? Because that's what they asked me when I got the supervisor. What can you bring to this role? Well, I have a credential. Well, that's great. I mean, I'm a nurse. That's great. That's nice. Interviewers are given the permission to scrutinize you. Just so you know, what I've done, I'm learning this now. Redoing interviews. You may look great on paper, but at the end of the day, it's what we want: results. And I think that's what's the bottom line. So the results for CDI, Jesse, just to answer your question, it has to have a balance. Do you have, I guess the question for any candidate is looking for CDI, do you have a balance between both clinical and coding? Like, you can't go into coding and then, you can't do clinical without coding. You can't do coding without clinical in CDI, because I did a video, and it's really, when you take a nurse and a medical coder, you got a CDI baby, and and after so many years of CDI being in the game and in people's radars, it's going to get competitive. The employers know exactly what they want. And so I think this is why, and this is going into for the new people, that if I had to give you advice, do what I did. Get people like on this platform, doesn't have to be recorded, doesn't have to be live. Get people on the phone and start talking with each other. We, in today's social media, we're all about emails and texts, okay, and posts. I appreciate all the graduation posts, but and they're looking for respect. But how do I respect you? I admire you, but I don't know if I respect you yet.
Right.
Because I don't know, because a post can only tell you so much. Right. I want a deeper dive into that person before I can think about respecting you.
Have a conversation.
Yep. Exactly. Just having a conversation, period, can do so many wonders.
That's right.
Not even talking about CDI can get you a job in CDI.
That's right.
Just so you know. So, yeah, go ahead.
Now, I hear everything you're saying. Equity is when you look at these jobs, and when I look at CDI, because I have been contacted by RNs who have gotten CDI jobs who don't know anything about coding, and they want me to do a crash course with them for coding. That's not how, but they've already gotten the job. Yeah. They've already been hired. Now it's up to them to lose it. And I remember you had even posted an article about a woman who was an RN who had a CDI job, and she just did not have the coding skills, and she lost the job.
Correct. So she was very new. An update. I never shared an update. She got a job.
Okay.
She got a job. She got fired, and the story is that she was nurse educator, director of nursing. Very strong nurse, right? And so she got this role. They hired her, but the thing is with the story is that it's a matter of the bottom line. They had a bottom line, and whoever recruited her, I think it was just wrong. Oh yeah, we'll train you. We'll train you, but how fast are they going to train you? That's the question you have to ask going into those questions. Into the interview, asking those questions. How long is this? You got to scrutinize the training process to the T, because you don't want to get burned in the end. So she got burned because after 2 months, they were already threatening her with termination.
Wow.
And she's just a brand new person. I've worked with nurses, and I've, brought them from no coding to understanding CDI and applying coding, not being proficient in coding, because coding takes many years to finally get it to click, right? And so her situation was oh man, she called me. She just reached out to me on Facebook. She says, Brian, I need your assistance. And I'm like, I think this is a situation like I'm kind of busy right now, and but her tone, her plea, her urgency was one that caught my attention. I had to help her. And so I know, Jesse, you're probably in the same situation, but at the end of the day, when you give your advice, it's a matter of what they do with that advice, and also talking about how employers are just bringing in nurses. Well, maybe that's their fault. They're just bringing in nurses thinking that they can assimilate into a CDI program, but at the end of the day, they can't.
Yeah, we've had many a conversation about that.
And so one thing to measure as a manager is attrition? I'm learning these new terms. Attrition, the turnover ratio. You could take a look at that. If I had to look at a program, I want to know what their turnover ratio is, right? Because if they're flipping CDI nurses, if nurses coming into CDI, they're not CDI nurses. They're nurses. Right. They're not CDI nurses yet, right? Because there's a transition. Right, you agree? And so I want to know what their turnover ratio is. I would even ask that in an interview. I'd be so bold because you're nurses, man. You guys get it done. So don't go into these interviews like naive. Please treat it as if you were going into your own nursing interview for whatever, charge nurse, manager, whatever, compliance specialist, case management. Scrutinize the interview because you have the power to do that. You do that in your job. You guys are strong-willed. Put that into an interview. And so, I hate where CDI itself breaks down a nurse. It's happened. Have you seen those instances where like they question themselves because they were up here as a nurse, but then when they come to CDI, they're like, they drop them to the back and the bottom at the start again, and it does things to them. I've seen it, it questions their ability as a nurse, but then just as a professional in general. And so I've seen that, but I've always helped them out. I've always helped my nurses out. I help my HIM people out. I help everybody out. But you could see that progression. It's just, it's tough. It's tough.
My main concern or my main question is, when or how as an industry can we stop this notion that the only people who can be CDIs are nurses? Especially when to be a proper CDI, you have to have a clinical background and you have to have a coding background.
Don't get me started, Jesse.
Get started, sir. Spill that tea. Spill that tea. That's what it's all about.
Hold on, Jesse. Hold on.
He needs more coffee.
Hold on, Jesse. All right. So this is going back to I've been doing the HIM advocacy for CDI for so many years. Okay. And it's to the point like I don't need to battle that anymore because I think I already started the fire. And I think you caught on with that fire as well. And so we're talking about diversity and things like that. And so early on, here's my story, right? I only had an RHIA, so take out that CDIP in the bottom, and I was still doing CDI work, and I did it for 9 years. 9 years, right? Yeah. And so I'm thinking like maybe I could do somewhere else. Let me see. I've been a very loyal employee to this healthcare system. Let me see where I can go. Lo and behold, I couldn't go anywhere with 9 years of CDI experience and my RHIA, which was the reason why I got my CDIP. That's why I feel like it didn't do anything, because even with getting my CDIP, it still didn't get me a job. Why? Because they wanted me to be an RN. I said, I am not about to go to nursing school just to get a CDI job. I am not going to be pigeonholed in this position. And so I went very vocal on LinkedIn. And I started to respond to vendors and companies that say, hey, we want CDI nurses. I said, well, what happened to CDI specialists? What happened to HIM? And so that went to ACTIS, the Association of Clinical Documentation Specialists, where at the time when I started the podcast, I started to really focus. If you see really early on in the history of episodes, they were CDI professionals, because that was my intent, is to kind of pick the brains of CDI professionals. So I talked to people like Dr. Cecil M. Hoko, who talked about the clinical truth, Glenn Krause, even the people from ICD-10 Monitor, Chuck Buck, who talks a lot about CDI. And eventually those connections, and I have to give a shout out to Dr. Lemhoko. He says, why don't you talk to Brian Murphy, the director at the time of Actis? All right, cool. Put it in my lap. Let me just do it. And so I interviewed him, and the same conversation, Jesse, is where I brought that up, and he agreed. I took it straight to the top. I never expected that to happen. And so because of those conversations, that I would like to say 2018, 2019, then that's where it started to have, from the top, we need to have diversity. And they started also having conversations on their podcast, bringing in HIM professionals, having those conversations as to why HIM professionals are qualified into the role and to create diversity. Because if you're just limited to nurses, well, then where's the coding support? Because the nurses are going to ask for, what's the code for this? How do I do this coding guideline? How do I do this coding clinic? But then you can't just go to coders, because they're focused on their productivity. They're a productivity-based role. So if they keep on getting requests to provide feedback, it's going to be very difficult for them. So this is why we need to have people in the CDI role, so that way there is collaboration, and a diversity to get the job done. Because if you have only, I could even say, if you only have coders in your CDI program, you're going to fail. If you have nurses only nurses, or even just physicians in your program, you're going to fail. I'm just going to say that. I don't care what other programs that are there that just physicians. If you don't have a collaboration, if you're not diverse, your program's going to fail.
Right. You got to have all those pieces at the table.
Your program's going to fail, and I'm going to go look at your turnover rate.
Attrition.
Yeah, your attrition. I'm going to look right at it. I'm like,
even when you mentioned Actis, they had an event earlier this year. I want to say April. So they had a newsletter that came out, and in the newsletter they had an article. 75% of because when I looked at all of the presenters, most of the presenters were RNs who just had their CCDS. They did not have a coding credential, and they were saying that 75% of the CDI people are nurses, but only a third of them have coding credentials.
Yeah. You have to think about early on when Actis was created, right? And so that's why I interviewed Brian Murphy. And so what you want to know is, when he first created, again, for Brian Murphy, I don't know what's wrong with what's up with Brian's and opportunities falling into the last, but it fell into his lap, right? And so he was tasked with a community of people who are interested in CDI. And maybe early on, they had maybe just, I guess, whatever the foundation was set, the term was nurses, from the get-go. And also, they forgot to think CDI used to be an HIM function. It was called DRG validation, done strictly by coders.
Yep.
Strictly by coders. Okay. Yep. So for us to be the OGs in the game and then have another profession jump in and then take over, I think that's where I started to, spill the tea all over the place, going like this. Okay.
And we talked about that a little bit last week, from AHIMA's perspective, like, where is their voice? Why are they not weighing in on these conversations to advocate for our profession in these roles where, no offense, Mr. Jesse, and we talk about this all the time, where these nurses are coming in?
Yeah.
Like, where is their, why don't we hear them?
I'll get to that. Yeah, I'll get to that. So for Actis, it was, a group of a population that needed a resource. So that's where Actis was created. And so I don't know how, when you think of population and social, behaviors, RN started to go into that group. Right. And people like me, HIM, I was waiting for AHIMA to, like, come on, CDI, capitalize on it. I'm like waiting, like, come on, like, I'm waiting. But Actis took advantage of that term. of that industry. They took advantage, and I have been told them that on the podcast. You took advantage of it, and ran with it. So it's a matter of who was able to capitalize first, and Actis was it. But then the nurses who are not familiar with AHIMA, they went to Actis. So you see where that pathway goes, right?
Okay, and so they're going to support their members, and they're going to support their,
of course, right? Of course. An organization with a group of people, they're going to support their people, right?
Right.
And so that's the reason why of that percentage, because people will gravitate to who they're familiar with, and over the years that's what happens. So going back to your AHIMA, right? So again, they didn't capitalize. I mean, I spoke that. I'm like, what's going on, AHIMA? Where's your CDI? Where's your CDI credential? Come on, get your stuff. Like I'm like vocally like, come on, let's get the ball rolling. Let's get the ball rolling. And so they were very, I think what the AHIMA compared to Actis, AHIMA's been around for so long. Right.
Forever.
It's one of the original or associations when it used to be medical records. I remember when AHIMA used to have nuns as presidents of do you ever see that? Ever go to a conference and they list all the presidents?
Yes.
I'm like, wait a second, there's a nun?
You see them on the wall. If you've ever gone to their corporate office, you see all of them on the wall.
There's a nun who used to be the president of AHIMA, because you think about like the role of what medical records is. And I think there was at a point where like, is there a fine delineation between where CDIs can fit in? But CDI is a very specialized role. And so their response, I think what they do is they observe. Okay. So at the time they had a different CEO when it first started.
Mm-hmm.
And so they changed CDI. They changed CEOs. I apologize. I don't remember her name, but she got into the role. She created just recently an advisory board.
Why, Lisa Harris?
Yes. Is that her name? I'm so sorry.
No,
and
fine.
they also included my colleague, Dr. Lim Holko. And so that's why it's good to be connected with people who can get to it. Really becomes a political game. And if you ask me, trying to get people into these advisory groups to help you to, I guess, lobby your what your opinions are, what you think should happen, and that person will speak on behalf for you. So
I'm glad for that partnership. I think that's a great idea. I still think AHIMA has a responsibility, because
I agree.
They have an exam. It's
a slow response.
Yeah,
I agree to that.
Yeah,
it's very slow, but AHIMA is slow, but they're very deliberate. Making sure to, and I mean, even in being in a state association, just trying to get something done, you have to pass it through the board.
I sit on the board of my state. Don't do
I
that.
know it just takes but the process in itself, like for us to be for me as a content creator, and you yourself as a content creator, when you want to get something done, you get it done.
You get it
right?
done.
But in the process of something like a state association and AHIMA, there is a process.
There is a huge process.
A long process. There is a legal process. There's a compliance process. So you see where I'm at, Jesse. It's like it's working. We want the results now, but we have to wait. We have to be patient. But what can we do in the meantime? Just like anything in society, we have to be very vocal.
That's true, because I just want to say for the record, now I am a nurse, but I'm an LPN.
Yeah.
So when it comes to the whole CDI thing, I as an LPN am in purgatory because I'm a coder, but the RNs don't consider me a nurse either.
Yeah, I know you're talking about.
I can do CDI outpatient, inpatient. It will never happen.
Wow.
Really? Wow. I'm totally different. I can never do outpatient. but I get your point, right? So LPN, RN, you see the ladder, right?
That whole
why
level.
can't so now we're at a conversation, where we had a conversation where it was just RNs and HIM professionals, right? So now the new conversation is, what about everyone else LPNs, another example, respiratory therapists, right? And so I had a colleague, I'm going to say his name is Brian Simpson, right? Brian Simpson. I don't know if you ever listened to that podcast episode, but he has a background in respiratory therapy, who is very much interested in CDI. He did everything. You have to pay your dues.
Yeah.
That's number one. Number two, you have to develop a good reputation, and it doesn't necessarily have to be in your coding skills. It's your network ability, plus also developing that good reputation. Because if you develop the good reputation, well, they're gonna say, well, Jesse is an LPN. He has such a good reputation. Of course, LPNs can do CDI. They automatically think in that direction. So when I think about Brian, respiratory therapist, he developed such a good reputation. He did the credentials. I told him, look, why don't you write articles? Show who you are. Don't
your
just
worth.
say, show your worth.
That's right.
Go to meetings, talk to people. Again, the lobbying, the advocacy, is something that is not given to you. You have to go out and get it. So, I'm just going to say very truthfully, people who are not RNs and not HIM, because you see we're HIM professionals because they started it. They were initially doing it, and so for somebody like LPNs and respiratory, you still got a long climb to go. But if you have people who believe in you and you develop that reputation, it's going to be an easier climb. I figured that much.
And it's doable. Like you said,
it's doable.
It's doable. It's just going to be a different route in which you started.
It's never a straight path either. It's never a straight path. And even also, Jesse, for medical graduates, they have a tough time too. So everybody, you have to think about, like, okay, is it just LPNs? Is it just respiratory therapists? What about speech therapists? What about then we have to open the door about what about physical therapists, because, when you think about where CDI can go, it can go many ways.
Right. Especially in those specialty areas.
Oh,
you would definitely.
No, I do understand that. I get that. But when we're talking about nursing, because there's a lot of people who don't even understand the difference between an RN and an LPN.
Yeah.
When it comes to the difference is clinical. Correct. Once you leave the bedside, knowledge is knowledge.
Yes.
Because RNs are legally allowed to do 4 things that LPNs cannot do. Mm-hmm. That's 4 out of this 4. So aside from that, the knowledge is the same. They teach us all types of diabetes like they teach RNs. There's only your lungs have 2 lobes on your left side and 3 lobes on your right side, whether you're in the RN school or LPN school. It doesn't change. The body is going to do what the body's going to do, and you learn how to do all that. So it's just like, to sum it all up, I'm glad we had this conversation, because Clarice has known, I've talked about it ever since I've been on Clubhouse. It's the gatekeeper for me that makes me sick.
Mm-hmm.
Yeah, that's true.
I think you shouldn't let the gatekeeper define, what CDI is, and I've always been one, if you could see there, not also classified right behind that plant there. I've always been one to think outside the box. There's always a different attack strategy angle.
You said knock over that gate.
Yeah. Whatever if you're passionate about it, there's always a way. And I wouldn't let the industry define what CDI is. And that's, I think, where most everybody is at, thinking like they're going to define, like I was at that point. Is CDI going to define who I am? Do I have to get a nursing degree? Do I have to go through the nursing program just to do CDI? Nursing programs is just, what is it designed for? To take care of patients. I am not going to take care of a patient in CDI. I am not going to do that. And so I came to that realization, is that this industry is not going to define who I am. I'm going to get it. And by golly, I'm going to do what it takes, right? It may be not the straight path. It may not be the right path, but it's a path, and it gets me there. And you can't be silent. You have to be vocal, communicate, share your thoughts. Like, Jesse, you're doing the work. Keep talking, keep having these conversations, because you'll get noticed. And then you're going to have that reputation. Like now I don't have to talk about it as much because there are people like yourself who continue to have these conversations. And then you pull me in for validation. I'm like, Jesse, I have your back. I have
That's
your
right.
back.
That's
100%.
right. Well, Brian, I know you have a tight time frame, a tight timeline. I know Demetrius has joined the stage. I didn't know if Demetrius had a comment or a question that he
Well, let me
wanted.
tell you something about Demetrius before I promised them I'll give him a shout out. Demetrius is a rising professional.
Yes, he is.
We connected with him in my RHI exam support group. He got his credential. Now he's looking into CDI.
Yep.
And so, just as a case example, I'm one to back him up. As a professional, we need to back up our new professionals.
That's right.
And so being a mentor to them, doing whatever it takes. So, hey, industry, Demetrius, check him out because he's rising. I hope he appreciates that.
All right. I'm trying to see if he wants to.
And I told him if we talk, but yeah, we got time. We got. Hurry up, Demetrius.
Oh, there you go.
I was just listening. Thank you for that, man.
Grinning ear to ear. I hear it all in your voice.
I hope y'all can hear me. I'm driving.
We can hear you.
Look, I try not to wreck when I heard him say that.
Yeah. I like to follow the progress of professionals, and I appreciate it.
And you and both you and Mr. Jesse, y'all speaking both very valid points. From listening to the conversation, I think it all comes down to just having that program be more open and versatile, like for all different walks, not just coders or nurses. And then one thing I really don't get is the LPN thing not being noticed, because you got it broken down into either registered nurses or coders, but coders don't have any clinical experience. So why would
exactly
that does have clinical? That's just weird to me. But I know it's a process, like you guys said. But I guess I just found that to be weird.
Cool.
Yeah.
Well, I just wanted to give you an opportunity to come up to the stage and speak with Brian. It was because of you, as I mentioned earlier, that I went seeking for those CEUs and ran into the medical coding geek, and here we are today.
Yeah, I appreciate that. Oh, one other thing, real quick.
Mm-hmm.
So I remember y'all touched base on CCDS certification versus CDIP. I want to point out to anybody listening, like if you go for the CCDS, they do require you to have at least 2 or 3 years experience in CDI to even get the test for it. And in addition to having a coding certification for coders, I think you could be a nurse too, but still you need to have the experience. Whereas a HEMA was the same thing for that, but as of recently, I'd probably say last year they changed it. Nobody was
right. That's right. That's right.
Yeah, they changed it to where
it's recommended,
required to preferred. So you could just have your nursing or your RIC or CCS, and you can just test for it. You don't have to have industry experience to test for it.
Cool. Well, thanks for that information as well. That's what's up. Well, again, Brian, thank you so much for joining us today. It has been a pleasure. And I know you're a coffee drinker, but tea was spilled. The tea was spilled. So silly. I look forward to collaborating with you on future endeavors. I'm excited, and I'm glad that we've networked. Even to Brian's point, you see people, especially you all in Clubhouse. I always tell you every week, there's people in here. Network with them, get to know them, have a conversation, even if it's a back channel message or email message. Have conversations, get to know people, because you never know the impact that somebody may have on you or the impact you may have on somebody. So reach out and say hi and what are you doing and what's going on with you? What's going on with you in your world? And you know, you never know. Things happen when people start talking. So this was great. I'm excited. This is a great show. So before I wrap up, make sure that you check out Brian at medicalcodinggeek.com. And then he has a slew of podcasts and stations and channels. He has the RHIT and RHIA exam support group. He has the Clinical Documentation Improvement Network. He has the Not Elsewhere Classified podcast community as well. And then, of course, the CEU hit list. So check out Brian. Again, thank you so much for joining us. If ever there's a time that you wanted to connect on this platform and reach our group or our people, just hit me up. We'll definitely get you in on our Saturday mornings. Yeah, this was great. This was great. Let me show you. You gotta thank everyone for a very positive and informative discussion. Yes, this was fun. I'm excited. We've been excited for 2 weeks when we found out.
Oh, really?
We're like, oh yeah. Like I said, Mr. Jesse was chomping at the bit. Like, yes. It's like I've been following for years. I was like, I'm new to the game, but I'm glad I got on board. This is great.
Yeah. I'm glad I connected with you. I just have to say Clarice. I'm like,
Yes.
how am I gonna say Clarice?
I
And
get it all the time.
I looked
All
at
the
your
time.
YouTube channel, and I'm very impressed. I am
Oh,
very
thank you.
impressed at
Appreciate that.
at your portfolio. Like again, thank you, Demetrius, because I'm like, who's Clarice? And so same thing. Like I think what you're talking about connecting with people is also be curious about people.
Correct.
And so I was curious. I'm like, oh, Clarice. All right, let me check out this YouTube channel. I'm like, what in the world? Where have you been? You know, like that type of situation. And the same situation for you, Jesse. I'm like, who's the coding nurse? So now I'm going
Yes.
to be very curious. And so hopefully, just like I'm pointing at you too, because
Yes.
it's formatted this way. I'm gonna have you on the podcast because I
Definitely.
haven't done it for a while. I just took a break, but I think this in itself, it just got me started again because I
Those
want to start
juices,
having
yes.
conversations. So I'll add you guys to the guest list. Jesse, I'm looking forward to extended. I'll give you long form 3 hour. I don't know how long you need, but
That's going
I'll wear
down.
you out in the interview
That's gonna go
process.
down.
It's gonna go to get ready. Get your coffee. You better have two coffees ready to go because we're gonna go at it. All right. So I appreciate it.
That's what's up. I'm excited for that. Yes. And I'm glad that yes. Okay. This has been great. So thank you. Mr. Jesse, do you have any closing thoughts?
I'm just over the moon. I'm just so glad I was able to meet and interact with Brian, and this was a great topic. And I look forward to having further discussions.
Love it. So thank you all again for joining the Saturday morning tea. Again, was the tea spill?
Absolutely.
Yes. So if this information was valuable for you, help us share this message with others by liking the video, sharing the video, and subscribing to the channel. You can also check out the Coding Nurse channel on YouTube. And Brian, what's your YouTube channel? Is it Medical Coding Geeks?
Yes, Medical Coding Geek, yeah.
And the Medical Coding Geek channel as well for additional conversations and content. Yeah, because I need to go back and look at some of these Brians that you've interviewed and to get some of those perspectives as well. So I'll be checking them out as well. And subscribe to the channels. Please, that is one way to keep these conversations going and get this information out to others. Last but not least, to my Clubhouse folks, don't forget to click on the greenhouse to join in the fun in our club, and you will get notified of our live broadcast that we have every Saturday. Oh, I guess I need to tell you, we won't have a broadcast next Saturday. I'll be traveling, and I cannot take all of this stuff with me traveling. I'm going on a senior trip with my mom to Savannah. I've never been to Savannah, so I'm looking forward to putting my feet in somebody's water in Savannah.
Yeah.
Okay.
check out Tybee Island if you're there.
Yes, definitely. So I'm excited. I needed that little vacation break, and so it's going to be fun. So we won't have a session next Saturday, but join me the following Saturday where we'll be here at 9 a.m. Eastern Standard Time. Again, this has been a great session today. Thank you all for joining, and remember, be safe, be kind, and don't wish for it, Work for it. Until next time, take care. And thanks so much for watching. Have a great weekend. Bye-bye.